Are you struggling to shed pounds after that new little one has arrived? You're not alone. In today's video, we are going to talk about some of the challenges of losing weight after childbirth, some of the hormone issues, reasonable timeline, and what you can do about it. I'm Dr. Carter with the Modern Body Clinic. So during pregnancy, a woman's bodies go through a lot of different changes. It's really incredible. Some of those changes including the muscles become more stretchy, the ligaments get more stretchy. Some of those are negative too. Sometimes you get pains where, like, why am I getting this pain there? That's weird. Some people get reflux, but it is an amazing process nonetheless. Some of those changes include gaining weight. So there are a lot of significant changes. Some of those changes include hormones. Yes, a lot of different hormone changes during pregnancy as well as after. I'm going to focus on a couple of the big ones that deal with weight. One of those is prolactin. Prolactin is a hormone your brain makes to help support the breast tissue and milk production. Turns out we do need that to be elevated so that you are producing milk. But also what it does is will slow your metabolism. So obviously that's a problem if we're trying to lose weight. Another hormone that gets impacted is cortisol. And cortisol is a hormone that we release in response to stress. The issue is when it's chronically elevated. Not getting enough sleep is one of those stressors that can lead to elevated cortisol levels. And so cortisol will also block your weight loss. Those two hormones together will make it more challenging to lose weight. But what's a realistic timeline to expect in regards to weight loss? So after childbirth, you're going to lose 10 pounds or so. Most of that is from the baby, of course, but there's some other things that happen. You'll gradually lose the rest of that weight over several months. And majority of women will lose most of their baby weight by 6 months. So you can expect something like 3 to 5 pounds in general over that time frame. There are some things you can do to really maximize or get the most out of this time. So one is breastfeeding. Breastfeeding is definitely great for the newborn, and just for that reason alone is highly recommended. Other thing is that with breastfeeding, you can burn up to 500 calories per day. So that's going to be helpful for weight loss as well. Though we also want to pair that breastfeeding with a balanced diet because it's going to support the milk production and the nutrients for the newborn, but also it's going to help with their weight loss. And the other thing that we like to do is pair that with some type of exercise. So there are a couple myths in regards to post-pregnancy weight loss. One of them is that breastfeeding alone will shed all those extra pounds. That is not true, unfortunately. We do want to do other things, so breastfeeding will definitely help. But the diet is the mainstay. It's super important, and then exercising. Another myth is that I can immediately start intense workouts after birth. Definitely not true. In fact, you're going to want to wait 2 to 4 weeks, depending how your birth was, if it's requiring any surgical interventions. Do you have a C-section? Do you have a episiotomy? Those will affect how long you have to wait before you can level up your exercise. Definitely talk to your obstetrician or provider about that. So what are some other practical tips besides breastfeeding and diet that we can do to maximize our chances of losing weight? So one is staying hydrated. Hydration is super important. One is going to increase your metabolism. The other thing is going to help with your appetite. Sometimes when we're dehydrated, we feel hungry, and so we eat when we should be drinking water. Another thing you can do is maximize your rest. I know that is difficult if you have a newborn, but one of the things you can do is sleep when they sleep. Newborns sleep way more than adults. So if you take the opportunity to sleep when they're sleeping, you can get more rest. Now, I understand that's not always doable, but that could help. The other thing you want to do is really make sure you have support. So from friends and family, you can join a group of new moms. They can really help you with tips and just have a shoulder to lean on. Remember, breastfeeding can be super helpful for losing weight, but also for the newborn. We also want to make sure that we have a balanced diet and exercising when okay by your provider, and making sure we get enough rest. If you want some extra help, check out the link below. It is a short video course on how to lose weight without starving. If you found this helpful, please subscribe. Otherwise, check out one of these videos on weight loss.